Manning Family Children's is an academic children's hospital here in New Orleans it's basically a quaternary referral center that takes care of kids from all over Louisiana. It's a freestanding children's hospital. And so there we do our pediatric orthopedics rotation. And that's one thing that's really special about our program. So we don't have to go somewhere else for pediatric orthopedics. We actually get training in pediatric orthopedics throughout 3 years of residency.
As a second year at Manning Family Children's, you're taking primary call. You and the attending are the only two people in the hospital getting called about orthopedic problems. So a lot of responsibility falls on you early as a second year. You're seeing consults during the night. You're making decisions, you're reducing fractures, you're getting patients set up for surgery the next day. It's really taught me how to be empathetic towards my patients. It's taught me how to really kind of take time, even if it might seem like it's a lot of time, to explain things and really go through the processes and the risks, the outcomes that we can expect. And we always talk about developing your hands, and so that you can be a good surgeon, you have to have good hands. And I think at Children's, you really do get to work on your hands, making these small micro adjustments. Surgery is not something that requires brute force, it's something that requires a little finesse. And I think you really do get to develop that when you're at Manning Family Children's.
So a lot of people in orthopedics say, oh, I don't want to do pediatrics because the worst part of that is dealing with the parents. But I think the parents are a huge blessing. They're people who really care about their child. They care about the patient that you're going to take care of. And so it's really talking to the whole family, not just talking to the parents, but talking to the kid as well. This is something that you're going to apply to whatever field you go into, even if it's not pediatric orthopedics, if it's arthroplasty or sports medicine, you're still going to have these discussions with patients and their families and have to guide them towards what might be the best option for them.
Practicing pediatric orthopedics is very different than adult orthopedics. You have to think about things in a different way. They might not just be a normal kid, they might have some sort of syndrome or other disease that's part of why they also have orthopedic problems. So I think it really pushes you to look at the patient as a whole. And what's nice is Manning Family Children's is structured so that all these specialties are under one roof. So if you need to call in the endocrinologist, they're there to talk to you and kind of explain to you what's going on with the patient. Our fifth years don't run the pediatric ortho service, it's the fourth year. I get to be a chief for the first time and get my feet wet and experiencing, how to run a schedule, how to manage a really big team, because there it's not just us, it's 2 lane residents and it's visiting residents from Michigan being the one that decides who does what and intervenes with staff and just kind of being that chief role for the first time. So I'm excited to do that.
One of my favorite cases in all of residency was getting to take care of a child with osteogenesis imperfecta. And since he'd had many other tibia fractures in the past, his tibia, it wasn't straight, so it was crooked, and he'd had a fracture through one of these areas where it was crooked. So what we had to do is we had to do something called sow-field osteotomy. We had to cut his tibia and realign it, and then it's almost kind of like a shish kebab, a skewer. So then you send a telescoping rod down to help his bone heal, and he ended up healing. But the coolest part about taking care of this patient was getting to talk to him post-operatively, because he wanted to look at the x-rays, he wanted to see what had been done, he was curious about his own care, and he really liked the engineering aspect of orthopedics, so he was asking all these questions, and so that was really special getting to talk to him. It kind of makes me teary just to talk about it, because it makes me super happy. So.